We often treat stress as a psychological failing. If you just meditated a little more or thought more positively, you could easily calm down. But chronic stress is actually a mechanical failure. Your autonomic nervous system is designed to shift gears based on your environment, but under prolonged pressure, it can seize up and lock in place. This system relies on two main branches. The sympathetic branch acts as your fight-or-flight accelerator, while the parasympathetic branch is your rest and digest brake pedal. Normally, they keep each other in balance. When the accelerator gets jammed down for months on end, positive thinking cannot unstick it. You need a physical intervention to pry those gears apart. Modern life is highly effective at keeping that accelerator pinned to the floor. Constant deadlines, financial pressures, and endless alerts trick your biology into a state of perpetual low-grade threat. This chart shows what happens when that threat response stays active over time, a condition known as low vagal tone. Heart rate variability drops rapidly, while systemic inflammation climbs. The body loses its repair capacity, sleep cycles become fragmented, and runaway inflammation damages healthy tissue. A nervous system caught in this loop cannot easily self-correct. To break the cycle, you have to find a way to manually hit the biological brakes. That biological brake pedal is the vagus nerve. It is the longest cranial nerve in the body, branching down from the brainstem to connect directly to the heart, lungs, and gut. Because your nervous system communicates using bioelectricity, researchers discovered we don't have to wait for the body to calm itself down. We can send targeted electrical micropulses directly along this specific nerve pathway. Today, this process, called vagus nerve stimulation, or VNS, is delivered through two primary methods: surgical implants and non-invasive wearables. For severe, treatment-resistant conditions like epilepsy or clinical depression, doctors rely on implantable devices. A small pulse generator placed in the chest sends regular electrical signals to the nerve in the neck. But for managing daily anxiety, burnout, and sleep disruption, transcutaneous VNS devices offer an alternative. These wearables clip to the ear or rest against the neck, delivering precise electrical pulses through the skin without requiring surgery. Whether the hardware is implanted by a surgeon or worn at your desk, the underlying mechanism is identical, applying external electrical current to force the body out of fight or flight. When the electrical pulse hits the brainstem, it triggers an immediate chemical response, releasing calming neurotransmitters like serotonin and GABA. Those signals travel back down, activating the cholinergic anti-inflammatory pathway. Reaching the organs, they actively shut down the production of inflammatory proteins. This is a measurable biological suppression. It actively blocks the specific pro-inflammatory cytokines that fragment your sleep architecture and cause chronic joint pain. By applying a tiny electrical current, VNS acts as a hardwired biological switch. It instantly halts rogue inflammation and forces the physiology back into a state of rest and recovery. Getting immediate relief from acute stress is useful, but researchers wanted to know if this electrical intervention could physically retrain a damaged nervous system over the long term. The clearest clinical proof comes from a recently approved stroke rehabilitation device called the Vivastin system. When stroke patients perform physical therapy exercises while simultaneously receiving vagus nerve stimulation, their brains are flooded with acetylcholine and norepinephrine. These specific chemicals radically increase neuroplasticity. They make the brain highly adaptable, allowing it to rewire itself and relearn lost physical movements far faster than physical therapy alone. It operates entirely like muscle memory for the nervous system. Targeted electricity proves that we can permanently rebuild neural pathways that are damaged or stuck. This technology represents the early stages of a developing medical discipline known as bioelectronic medicine. For decades, we treated systemic diseases almost exclusively with pharmaceutical biochemistry. Now we're learning to treat them by modulating the body's internal electrical grid. The clinical applications are expanding rapidly, from clinical trials treating rheumatoid arthritis to accessible consumer wearables aimed at combating insomnia and burnout. A nervous system locked in chronic stress or struggling with low vagal tone does not have to be a permanent condition. Human biology is highly malleable. With a clear understanding of our own internal wiring, we finally have the tools to physically tune our biological rhythms back to a healthy baseline.